Well, we can now speak to the Shadow Health Secretary, Wes Streeting. A very warm welcome to the programme. I suppose listening to that, any right-minded person would welcome anything that improves access to GPs and therefore the well-being of the nation. I suppose all eyes will be on how exactly the Conservative government is planning on funding this.
Yeah, we'll see what the Health Secretary says, but I've got to say, after 12 years in government, I think it's outrageous, actually, to present a 2-week wait to see a GP as good news for patients. When we were in government, we guaranteed GP access within 48 hours, just 2 days. We've got the biggest crisis in the history of the NHS, much of it a mess of the government's own making. And I think at this stage, after 12 years, expecting the Conservatives to deal with the NHS crisis is a bit like expecting the arsonists to put out the fire they created. It's not going to happen, and the longer they're in government, the longer patients will wait.
Well, look, we are where we are in terms of where what is happening within the NHS at the moment. So, what would if you were in power? What would you do? What is the answer here?
There are immediate levers and then there's the fundamental. On the immediate levers, I think the government's got to deal with the fact that doctors are leaving the NHS workforce for no other reason than pensions rules create a financial penalty if they stay. Let's deal with the pensions issue the doctors have been raising for months now. Let's make sure that we deal with those delayed discharges from hospital, 400,000 each month, because the support isn't there in social care settings. Let's use some of the money earmarked for social care for better pay and conditions so we can recruit and retain the care workers that we need. Let's ease pressure on GPs by using community pharmacy for vaccines this winter. Let's mobilise the Jabs army of volunteers to help with the flu vaccine, with the COVID booster, with the monkeypox vaccine that are all creating pressures on GPs. Those are some of the quick fixes, but there's the fundamental. Unless we recruit more doctors and nurses, unless there's a workforce plan for the NHS, there just isn't a plan for the NHS. And what really worries me is that this is our third health secretary in 6 months, and I've not seen any sign in the newspapers that she's planning to grip that particular issue. It is the fundamental issue. It is the reason, above all others, why doctors and nurses are leaving the NHS in record numbers. They don't feel the cavalry is coming. And unless we recruit those doctors and nurses, more people will leave the profession. That means longer waits, worse care, and I think people are sick and tired of waiting.
Well, to be fair, from what you've outlined there is certainly a lot of overlap with what Thérèse Coffey is promising today. She said she's going to tackle that issue with pension rules, which have driven this exodus of medical staff overseas or away from NHS work. And indeed, pharmacists are among those that they will be leaning on as well. But we put this to her this morning, that many pharmacists are unhappy with the situation they face at the moment, overworked, underpaid themselves. And is that necessarily fair to put more pressure on them?
Well, that's why we've got to deal with the fundamental problem in the NHS, which is the workforce challenge. And unless the government's got a plan for that, they don't have a plan for the NHS. And I think it's unforgivable, actually, after 12 years in government, they haven't got that fix. Yes, they might come along this morning doing some things that Labour and others have been calling on them to do for months now. I'm not going to be churlish and oppose it. Of course, that's what we've been calling on them to do. But they've also got to fix the fundamentals. And unless they do, we will end up continuing where we are now, the worst crisis in the NHS's history, the highest waiting list in the history of the NHS, the lowest patient satisfaction since 1997, and patients suffering in agony, sometimes even dying on these waiting lists. That's how serious this is. And as I say, I don't believe that the Conservatives can deal with the fundamental challenges facing the NHS. Next week at the Labour Party conference in Liverpool, I'll be setting out our plans to grip the crisis and build an NHS that's fit for the future. And I'll be very happy to come back onto your programme to talk about those plans in more detail.
Good. Well, we'll definitely book you in for that, Wes. But, I mean, you talk about building a new NHS. Well, a lot of people, a lot of medical experts that we talk to say, even if they don't say it on camera, they'll say it quietly, that there needs to be root and branch reform. And that's what politicians of all parties are terrified of doing, because it potentially upsets a lot of people. But isn't that needed now? Doesn't the NHS really need to be looked at and restructured to make it work?
If the answer is only ever pouring more money in, the honest answer is we're not going to have an NHS that's sustainable in the longer term. I agree with that argument about the need for change and modernisation. That's going to be at the centre of my speech at the Labour Party conference next week, because I think when you compare the NHS to other healthcare systems, we're spending far too much money further down the patient journey in hospitals, dealing with problems that are now very expensive to solve, whereas if we got there earlier with primary care, social care, mental health, social care, all of which are relatively underfunded compared to other countries, then people end up with worse health outcomes. It costs us more money as a system. So I agree, we do need to reform the model of healthcare in this country, because one thing I want to preserve is an NHS that's free at the point of use. I think that is the core of the NHS, the heart of the principle, the thing that we all cherish about the NHS. We've got to hold on to that principle with change and modernisation and giving patients the better care and better patient outcomes, because ultimately that's the thing that matters most.
Look, just before we let you go, we've just heard that the moratorium on fracking has now been ended. What's Labour's position on that? I mean, we're in an energy crisis and a cost of living crisis. Is it sensible that moratorium has been removed, that we look at becoming more energy sufficient?
No, I don't think it is sensible. I think people are going to be absolutely outraged, actually, because the Conservatives promised at the last election that they wouldn't resort to fracking. There are going to be a lot of unhappy people out there, and quite rightly, because it's not just the concern about the environmental damage of fracking, it's the fact that it's more expensive and less effective than the renewable energy sources out there, which if the government got a grip on renewables and building our renewable energy base, including new nuclear, that would be a much better approach than fracking. In fact, if the government had adopted Labour's approach of insulating homes across Britain when we called for it, we could have done 1 million homes in the last year and brought people's energy bills down straight away. There is a way of building energy security in this country. There is a way of bringing down people's bills, but I don't think fracking is the answer. And I think people are going to be pretty disgusted, actually, that their MPs that they elected told them that they wouldn't support fracking, and now the Conservatives are breaking their promise. If Liz Truss wants a new mandate for broken promises, she should call a general election and ask for permission. But I think this will go down like a bucket of cold sick in communities that are going to be affected by fracking.